Hi, my name is Liz Caulfield and I'm a registered nurse at Latitude Food Allergy Care. For many of our OIT patients, we do like to educate the families on the proper use of the EpiPen and to empower them with knowledge regarding anaphylaxis. So anaphylaxis is really the body is totally overreacting to what you're allergic to. So if you have environmental allergies and you inhale the pollen of the trees, you get the stuffy nose, watery eyes, itchy skin. If we eat an allergen that we're allergic to, we have something in our body called mast cells. They start to secrete histamine, prostaglandins, and other chemicals that start to float through the bloodstream. When that happens, it can affect your respiratory system, your cardiovascular system, and your gastrointestinal system. So this is what a normal airway looks like. There's muscle on the outside, tissue on the inside. In anaphylaxis, very similar to what happens when an asthmatic has a flare, that muscle starts to get tight and spasm. The tissue starts to get swollen and produce mucus. And this is your end result. You have constriction and inflammation. So what you would hear on the littles, especially on the exhale, is like a whistle or a wheeze. The air is now meeting resistance as it's trying to get out of the airways. In the upper airways, the mucosa of the nose can get either very congested or very drippy with a lot of sneezing. In the cardiovascular system, we have blood vessels. In anaphylaxis, the blood vessels start to dilate. When they dilate, the blood pressure drops. So what happens when our blood pressure drops, we don't have enough oxygen going to the brain, we feel dizzy, lethargic, we can lose color in the face. In between the arteries and veins, there's something called capillaries. In anaphylaxis, the plasma from our blood leaks out of the capillaries and it goes deep into the tissue. When that happens, you might see what's called angioedema, puffy eyes, puffy lips, puffy face. If the inflammation is right under the surface of the skin, that's when you're going to see those red bumpy hives, okay? In the gastrointestinal system, we have smooth muscle. In anaphylaxis, the smooth muscle starts to constrict. That's when you're going to see nausea, vomiting, diarrhea. So when do you give epi? We're looking at a 2-hour window with our oral immunotherapy. If ever it's respiratory, if ever it's wheezing, difficulty breathing, I feel like my throat is closing, an elephant's sitting on my chest, you're gonna take the EpiPen and it goes blue to the sky, orange to the thigh. It can go right through clothes. You take the lock off and you go 3, 2, 1. And in this instance, then you would give Zyrtec. Depending on the age, would be 2.5, 5, or 10 milligrams of Zyrtec. Then you would call 911 or go to the ER. If you're waiting for paramedics to come and 10 minutes has passed and he's just not getting any better, you're gonna take the second EpiPen and now you're gonna do it in the other leg. And the reason why you do it in the other leg is because once you give the epi, it causes vasoconstriction. We want adequate absorption, so you give it in the other leg, okay? So if it's ever respiratory or 2 systems. So let's say he gets a puffy lip and a puffy eye and then vomits. That's 2 systems. That's epi, Zyrtec, call 911. Let's say he breaks out in hives and has diarrhea. That's epi, Zyrtec, call 911. Let's say he just gets a little puffy lip. That's just Zyrtec. He gets a couple hives. That's just Zyrtec. Vomits once or has diarrhea once. That's just Zyrtec, okay? So if it's ever respiratory or 2 systems or vomiting more than 3 times. If he vomits more than 3 times, that tells us he's still digesting the allergen and something else is going on. So that's when we're gonna do epi, Zyrtec, call 911. So what happens when you give epi? That airway that was constricted and inflamed, once you give epi, now it starts to open up. He's able to breathe. In the cardiovascular system, once you give epi, those blood vessels are now going to constrict. Blood pressure is going to go back up. He now has oxygen to the brain and he feels a lot more awake and alert. In between the arteries and veins, once you give epi, the plasma is going to stop leaking into the tissue. The puffiness and the hives takes a little bit longer to go away, and that's why we piggyback on the Zyrtec. So Zyrtec does not prevent anaphylaxis, but Zyrtec will help those mild symptoms to go away. In the gastrointestinal system, that smooth muscle that was constricted, now it just starts to relax. So no more nausea, vomiting, or diarrhea. So it's super important to empower yourself with this knowledge so you're not scared to use the EpiPen. You just think if it's ever respiratory or 2 systems or vomiting more than 3 times. You know, there's so much fear and anxiety with children with food allergies, and our goal is to empower you with the knowledge so you're not scared to use the EpiPen. So this is a whole team here to support you. This is all we do here at Latitude is food allergies. So you can call us, you can message us through the app. We are here just to support you as a team.